Good evening, everyone. Can you listen to me?
Good evening, teacher. Yes, I can hear you.
Okay, thank you. And can you watch my screen?
Yes, teacher.
Perfect. Where were we? Here. Okay. Maybe Rina, can you read this part, please? Or maybe Claudia?
Okay, teacher. Mental state examination. A declusion is a firmly held belief which is wrong but not open to argument. For example, a deluded patient may not accept that his psychiatrist is in fact a psychiatrist. Dementia is significant mental deterioration due to physical changes in the brain. Disorientation is mental confusion about time, place, or identity. Hallucinations are apparently normal perceptions which happen without the appropriate stimulus. Any of the senses can be involved, but especially vision and hearing. Illusions are misinterpretations of real stimuli. Obsessional symptoms are stereotyped ideas or impulses which the patient cannot resist. They include obsessional thoughts and obsessional rituals.
Okay, thank you, Claudia. Well, as you can see at the mental state examination, after all the types of examination we already saw, it's a part that maybe we don't use regularly, but maybe you can tell me in which cases do you think it's important to make this kind of examination? In which cases do you think it's important?
Hey, teacher. I think, well, maybe we should use all the time, but specifically when we have old patients over 60 years.
Okay. Okay.
Yeah, I think it's necessary. Okay.
Yes, I think the same. Any other one can tell me? Jorge, maybe?
Yeah, I think we should base our examination on the patient's, for example, in this case, beliefs or actually the full history. When you see something like it's not common or normal, you should start like a different kind of examination.
Yes. Okay. Do you think everyone is, I mean, in the area of health, everyone is capable to do this kind of examination, or maybe to have some tips to do these questions or examination, or just the physicians?
I think it's not only for the physicians, but because all these symptoms, it can be also just symptoms for another disease like brain tumors or, some diseases of the brain specifically. And it's important to identify very well what kind of disease could be to direction to the patient to the right specialist, like a psychiatrist or a neurosurgeon, you know?
Yes. Okay, Claudia, thank you. I agree with you. Okay, thank you so much. I don't know if you have any questions for any word you cannot understand. Or maybe we can continue.
Yes, teacher, we can continue.
Okay, thank you. Let's continue then. It was the last important part in this topic. Now, I will share with you. I don't know if you can see my screen with a presentation.
Not yet.
Not yet, thank you. Okay, maybe now.
Yes.
Thank you, Mateo. Okay, this part is explain the diagnosis and management. We already saw the examination part, the medical history and everything. And Mateo, can you read this part, please?
Okay. Number one, diagnosis, identification of disease from its signs and symptoms. You are suffering from. You have developed. You have. This is mainly because. This is mainly because. This is why. Explanations. The final part of the consultation, which should cover. That's what I should read first.
Worries. Okay, thank you so
Sorry.
much. Yes, no worries. Yes, the explanation is the final part of a consultation, which should cover the first part, diagnosis, which means the identification of disease from its signs and symptoms. And we can say to the patient, you're suffering from, you've developed, you have, this is mainly because, or this is why, and give some recommendations. Okay, Melanie, can you read this part, please?
Yes, Miss. The management plan, including investigation and treatment. I'll make you an appointment with. I'm going to start you on medication too. I'm going to have you admitted too. I'll arrange for you. You'll be given. I expect you'll have. They may advise. That is all, Miss.
Okay, thank you so much. Well, the first part is, I will go back. The diagnosis, right? Into the second part, we're gonna see the management plan, including investigations and treatment. And you have these sentences that you can use to say to the patient. I don't know if you want to add something else here, or maybe a question here for vocabulary. What does it mean, I'll arrange for you? For example, I'll arrange for you an appointment with the surgeon.
To set up.
Okay. Okay, thank you. Any questions here?
No.
Let's continue then. Alejandra Macias, can you read this part, please?
Sure. General advice about change in lifestyle that may be needed. Nurse will give advice on you should try to give up. I want you to. It's important that you.
Okay, here we have some examples that we can use to explain or give some advices to our patients. I don't know if you want to add something. Maybe another way to say it. Do you think this is the order that you follow when you give some diagnosis, the management, and then a general advice? Should it be the protocol, or maybe there's another way?
Here in Ecuador, we almost say your lifestyle at first, and then the medications, and to finish the exams or test.
Okay. Okay, thank you, Carlita. Anyone else? Or is there any question for vocabulary here? Nothing? Can we continue then?
Yes, teacher.
Thank you. Okay. Andres, can you read this part, please?
Yes, teacher. The prognosis. What is likely to happen because of a disease stressing that nothing is certain? I expect that the treatment will. Hopefully we can never be absolutely certain about. You should remain optimistic.
Thank you. Yes. We have here the prognosis and what it means, what is likely to happen because of a disease, stressing that nothing is certain. Okay, and as you can see, we can use I expect the treatment will, or hopefully we can, or we can never be absolutely certain about, or maybe you should remain optimistic. I don't know if you have another phrase to add here. And I want to know, I would like to hear your opinions, if the prognosis is really important to explain to the patient in a certain way. How do you explain the prognosis to your patients?
It's very important, teacher.
Okay, Claudia, tell me more.
Yeah, for example, the last Thursday I had a patient with a heart condition. The risk, the cardiologist says that she has a high risk to have a heart attack during the surgery. So I think it's very important to talk not only with the patient, also with the family, but because in that way, if you have complications during the treatment, in this case, the surgery or the anesthesia, they will be prepared for the complication that maybe we'll have, or another things that maybe we will need, like intensive care after the surgery. So it's very important.
Okay, thank you so much, Claudia. Anyone else?
I think that it's important for patient take a decision about the if
Okay.
continue the treatment or leave.
Thank you, Andres. Anyone else? I know you all had experiences given maybe the prognosis or maybe saw your also your colleagues or some other doctors give some prognosis. I really would like to hear about that experiences. Nothing else to share with me or with us?
Well, I think the prognosis, it's very important to know how to explain to the patient because it all depends, of course, about the how or the way, like the physician explained the prognosis, because not all the prognosis are good or will be better the situation at the actual or the situation the patient. So before the prognosis, it's very important to explain the treatment. After that, a base in the treatment, we have to talk about the prognosis, positive or negative, what we expect. For me, that expression, that's good, because we have to start to explain with positive way, and after that explain the another way, what happened if the treatment will won't work it, or what happened if the treatment will work, or how much, or how many the health of the patient will get better with the treatment. For that, the prognosis, for me, it's a very important, and it's indispensable to know how to explain the patient.
Okay, thank you, Rina. Yes, and I will make a little emphasis in that thing. I know we have a lot of things to do and to say maybe to our patients, but please always remember that your patient is coming to you because they need help. So be kind with your patients anytime. I saw a case a few days ago where a patient was treated so bad from a physician, and it was kind of, I don't know how to explain. I felt so angry with that, because we don't have we cannot be like that with the patient, right? And maybe some of the patients are they don't have money, they assist to these places because they need that help, and the physicians were not all of them, but some of them, they lost this kindness. And please be better than that, okay? Just like an advice.
I think the word you want to say is empathy. Empathy. Try to be
Yes,
empathic.
we have to be so. We have to.
Yes.
Okay. Okay. Thank you so much. Let's continue. Okay. help me here. Valeria, can you read this part, please?
Question time, where the patient can ask questions about his or her illness. Do you have any questions? If there anything that you like to say?
Okay. Do you think this part is important?
Yes, because we can resolve any questions that the patient has about the procedure or what are we going to do to him, so he can be more confident or calm and to not to stress about it.
Sorry, Vale. I couldn't listen the last part.
And nothing that it will pardon, I'm sorry, confidence to the patient for us to resolve any doubt.
Okay, thank you. Please tell me if you have any questions, okay? Carla Barta, can you read this part, please?
Yes. Using lay terms in explanation. Explanation should be given in words the patient will understand, avoiding medical jargon.
Sure.
Using lay terms, words familiar to people without medical knowledge, can help patient understand explanation. For list of some common lay terms for condition, parts of the body and medication, etc.
Okay, thank you. Yes, we have to use lay terms in explanations, okay? Those explanations should be given in words the patient will understand, avoiding medical jargon, using lay terms. Remember, please, lay terms should be used. Words familiar to people without medical knowledge that can help patients understand explanations. Okay? Do you understand this term, lay terms? Do you understand the meaning?
Yes, teacher.
Teacher, what is the meaning of jargon?
Jerga.
Oh,
Maybe in this case. Okay.
thank you.
No problem. Okay. I don't know. Okay. Mateo, can you read this part, please?
Okay. An explanation for angina. Having examined you, I'm confident that you're suffering from angina. The heart is a pump. The more you do physically, the harder it has to work. But as we get older, the blood vessels which supply oxygen to the heart begin to harden and get furred up. So they become narrower. They can supply all the oxygen the heart needs. The result is the pain you feel as an angina, as in angina. Because you are experiencing pain at the rest as well as an exertion, I'm going to have you admitted to the coronary care unit right away so that your treatment can start at once. You'll be given drugs to ease the pain, and I expect you will have an angiogram. They may advise surgery or angioplasty. That's a way of opening up the blood vessels to the heart so they can provide more oxygen. You should try to give up smoking. You won't be able to smoke at all in hospital, so it's a good time to stop. I expect the treatment will improve your pain at least, and you may get rid of it completely. We can never be absolutely certain about the future, but you should remain optimistic. But you should remain optimistic. Do you have any questions?
Okay, thank you. This is an example of an explanation of angina. Okay, do you have any questions here? Nothing?
Yes, teacher, what is the meaning of filled up?
Okay. Inside the vessels, we have some I don't know which is the name. I don't remember. Okay. But in Spanish, it may be peludo, por esto de los cilios, ¿ok? Que obviamente van a ser en demasía, ¿no es cierto? Y se va a volver más estrecho.
Oh, okay. Yes, teacher, I get it. Thank you.
Okay. Okay, any other questions? I'm sorry, I don't know if you can listen the noise behind.
No.
Okay. Thank God. Mm. Do you mean, do you understand the meaning of exertion? Nobody?
Yeah, in this case would be the opposite of rest, like while doing exercise or while doing something instead of resting.
Okay. Okay, thank you, Jorge. Oh, it's a little bit windy. I don't know if you can listen to me well.
Yes, we can listen, yeah.
Do you have any other questions, or we can continue?
I think we can continue.
Okay. Let's continue then. Okay, discussing treatment, offering options. Weimar, are you here? Well, I think he's not. In that case, Rina, can you read this part, please?
Yes, teacher. Discussing treatment, offering options. There are a couple of options we can use. First option is to try tablets like Prozac that lift you up a bit. The other option is counseling. It can be caused by diet or stress. There are some quite simple tests we can do. If you're still concerned, we can refer you to a hospital.
Okay, thank you. Do you have any questions here?
No, teacher, it's okay.
Excuse me, teacher, what does it mean counseling?
Counseling, it means when, for example, your physician maybe will need the help of a psychologist, for example, and they will give you some advices in some specific cases, like asesoramiento.
Okay, thank you.
Okay. Okay. Advising a course of action. When advising course of action, doctors may say, some time off work might help. If you felt that would be helpful, you could take a week and see how you felt after that. Carry thing might help, like raising the head of your bed. That's one of the simple things we could start you off with. You said you haven't tried indigestion remedies. That's, oh, sorry. I don't know if you can read the last part because I can't see it. On the last box, maybe someone can help me here, please.
Yes, teacher. Other thing might help, like raising the head of your bed. That's one of the simplest things we could start you off with. You say you haven't tried indigestion remedies. That's something you could try.
Okay, thank you so much, Marina. Okay, do you have any questions here for vocabulary? Everything is clear?
Yes, teacher.
Perfect. Okay, advising patients to avoid something. When advising patients to avoid something, doctors may say, there are a few things about your lifestyle we could address. Perhaps cut down on the amount you're drinking. Giving up smoking would help. Cut off fatty foods. Or you should try to avoid tight clothing, sitting in deep armchairs, and bending, especially after meals. That was a cat?
Yeah, it's my cat. Sorry, teacher.
Oh, no, no.
She just jumped into the mic. Sorry.
Okay. Okay. Let's go on warnings. Claudia, can you read this part, please?
Okay, teacher. Warnings. When a doctor wants to warn a patient that consequence of ignoring the advice could be serious, he or she may say, if you aren't feeling better in 7 to 14 days, you really must come back and see me again. If you need damaging it, you are going to end up with a long-term problems. If you feel that things are settling, aren't getting back to normal, it's important that you see me again.
Okay, thank you so much. Melanie, can you read this part, please?
Yes, miss. Giving bad news. Principles of giving bad news. First, give warning. I'm afraid your test results aren't very good. I'm sorry to have to tell you that NIWA isn't good. Two, choose an appropriate setting and have a friend or relative of the patient present. Three, take a time. Four, use appropriate language. Five, emphasize the positive. For example, there's still a lot of we can do to help you. Chemotherapy will make you more comfortable. And six, discuss the prognosis. One can never be certain about these things, but I'd say it's a matter of months rather than 10 years.
Rather than 10 years. Okay, thank you so much. I don't know if you have any questions here. Can we continue then?
Yes, teacher.
Thank you. Jorge, can you read this part, please?
Sure. Okay. I'll supplement the verbal message. I'd like you to record this consultation so you can listen again if anything isn't clear. Arrange a follow-up session. I'd like to see you again next week. Can you come in again next week? Confirm that the patient understands. Could you tell me what we're going to do for you? Is everything clear to you?
Okay, thank you. Do you think it's important to record the consultation or the explanations? It's necessary sometimes nowadays.
No, I don't think that would be right, but because you have these ethical elements, I don't know how to say that.
Mm-hmm.
The confidentiality of the patient is very important, but when you are going to make some procedures, you can get this I don't know how to say that in English. This consentimiento informado.
Okay.
So the patient accept what are you telling, but recording, I don't think it's a right thing.
Not even on explanations, maybe just to let to give your patients a chance to listen again, or maybe write it down. It would be the better way.
We can write it down. Also, we can make some these lifestyle or recommendations we can give in a sheet with all those recommendations to the patient, because the patient could forget it, or you can send a mail with these recommendations. But recording, I don't think it's a good thing.
Yes. Okay. Okay. Thank you, Carlita. Any other opinion? And we were talking about informed consent. Nobody? Mateo, can you read this part, please?
Okay. A consultant medical oncologist's report. Mr. Harry Scott, diagnosis, previous pancreatic cancer. I reviewed Mr. Scott in the oncology clinic today. He has been less well and has lost 12 kilograms in the past few months. Unfortunately, his CT scan shows an area of ill-defined low attenuation in the tail of the pancreas. Although this is consistent with focal pancreatitis, the general feelings at the multidisciplinary team meeting was that this represents recurrent disease. This is especially likely in view of his clinical deterioration and rising CA at 19.9. I discussed this with Mr. Scott and his wife. He was absolutely disappointed with the scan results, but still tries to remain positive. We discussed the fact that surgery wasn't an option and symptom control was important. We also discussed the role of palliative gemcitabine. The potential benefits are small, but is usually well tolerated, and he was keen to proceed with this. I will therefore book him into Ward 2 to start treatment in the next few weeks and have rechecked his bloods today. In the meantime, I would be very grateful if you would refer him to your dietitian. He himself is keen for this to happen. We will see him back in clinic once his treatment has started.
Okay, thank you so much. Anything that you cannot understand? Nothing? Everything is clear? Can we continue? Can we continue?
I think we can continue.
Okay. And it was the last part. Thank you so much. Okay. Okay, guys, thank you so much. First of all, for changing schedules this weekend or this week, because I have a lot of trouble coming earlier to the class, okay? And I don't know if you have any questions about your schedules. Nothing?
Just to be sure, we will have the same time for practice class today as tomorrow, right? And for Wednesday and Thursday.
Yes, it would be the same if it's good for you.
Yeah, that's good.
Yeah.
I just want to be clear on that. Thank you.
Okay. Thank you. Okay, yes, it will be the same schedule. I will send to you my questionnaire, okay? And just to I will send to you the practice. I think 2 practices, okay? I don't know if you can see my questionnaire.
Yeah, we can.
Fill it for me. Remember that on Monday would be the final. And it would be at 8 o'clock. So please organize your schedules to be there, okay? I need one more to fill the questionnaire. Everyone can see it.
Not yet, teacher.
Rina, you cannot see it?
The first one, yes. The second one, no.
No, it's just one
Ah,
questionnaire.
okay. So I finished.
Okay, thank you. I don't know if you can see it, all of you, or you cannot. Okay. Okay, guys, then see you at 9, sorry, at 9, with, who's gonna start? Claudia, I think?
No, me.
Carla, Andrés, Claudia, Jetro, Carla Barta, Vale Guerra, y Ale. Okay?
Okay, teacher.
Okay.
Okay, thank you so much. With the others, see you tomorrow, okay? Thank you.
See you, teacher. Bye.
Thank you.
Bye-bye.
Thank you.
Thank
Bye.
you.
Thank you, teacher. Bye.
Bye-bye.
Teacher, no me llegó el cuestionario.
Weimar. Okay, I will send it to you. Stay here. Uh-oh. No. Well. Okay. Now you can see it.
Thank you, teacher. Goodbye.
Thank you. Okay. Okay, Carlita, how are you?
Fine. Fine, thank you. Yeah.
I'm fine, a little bit tired, but
Yeah,
fine.
I can see you.
Yeah, I have to run from a little town and start to give classes. I have we're gonna stay here until 10:30, I think. Then I have to prepare some other things for tomorrow. It's a crazy week.
Yeah, it's a long day.
Yeah, it would be. Okay. Okay, let me just, what do you think about this, the way you treat the patients? What do you think it's important? Not only for you, but for the patient.
Well, I could remember when I just got graduated as a general doctor, and now that I am family doctor, so there's a lot of difference from who I was when I was like 25 years, and now that I'm 35. So the first thing I think we learn in medical school to see the patient as a person who is suffering some biology disease. But now, after 3 more years of studying, we, as family doctors, we see the patient as an integral person. So sometimes you have some patients with headache, maybe, for example. And normally, as a general doctor, I could just try that headache, some analgesic, some advices, and that's all. But as a family doctor, we change that perspective, and we see the patient as an integrate person. So we ask about how's the things going in house, in what do the patients for live, and we discover some other causes like family problems, economic problems, community problems, and then you have another perspective of what's the reason of that headache. So I could say that as a family doctor, we changed that that horizontal view of the patient and the disease, and understand that health is more than the causes of a disease. So even also I was telling you empathy, because sometimes we could be great doctors, have a lot of knowledge, see the integrity in a patient, but we forgot to use the correct words or to be careful with the treatment with the patient. So you don't have any title, I don't know, any study to be empathy. Empathy it's in the nurse, in the dentist, in the safeguard, I don't know, that it's in the door of your consultant. So empathy, it should be the first thing that you use when you have a patient, because I agree with what was you saying about the patient is going to the doctor or the health professional because that patient, it helps not only biology, but sometimes the patient only needs to be here, and that's all.
Yes. I agree with you, Carlita. That's right. I have worked for 7 years with older patients, and I didn't know that I had a lot of patience until I worked with them, because they really need to be heard.
Yeah,
it's the only thing they want. Yeah, they come, and while I'm making the procedure, they are talking to me about their life, their problems, their efforts, and everything. And it's like, oh my God, I have to be a psychologist, a psychiatrist. Of
Yeah.
course, I'm not I don't do that role, but I try to guide them. And I think at the same time, for example, if someone really needs help that has to be solved by a specialist, I try to find out the right specialist to send to this patient, right? Even though I'm just a dentist, maybe I don't know what else can be happened, but I see something that is not correct there. So I think it might be a bigger problem, so the patient needs help. And I try to send them. I think it's, and I saw so many colleagues in my work that tries to do the same. And it's so, so loyal because it not only talks about the professional side, but the personal values. And it's interesting to find that kind of things on people that is work with patients, with people, right? That's interesting.
Yeah, I
And
think
empathy is the first.
yeah, I think I remember some friend of my family has lupus, and years ago she felt tooth pain, but it was really hard. So she went to the dentist and told him to extract, I don't know.
Okay, to make the extraction of the
Yeah,
the tooth.
to make the extraction, and the pain was still, and it was really painful for her. So she went again to the dentist and told her that extract another tooth, and there was like three tooth, teeth, teeth that has
Teeth.
been teeth that has been extracted, and it wasn't and the teeth was in good health. So it was an ischemic of this area from the lupus. But the dentist
Wow.
never asked if the patient has another disease.
First. No, that's the worst thing.
Yeah.
What happened with people? And
Yeah, and
that's
here,
why I was asking you.
yeah, and
Continue,
here,
continue. Sorry.
I think as a doctor, I see the worst phase from health professionals when the pandemic will this COVID, with the outbreak of the COVID, because there's a lot of doctors that makes a lot of money.
They just wanted to
administrating medication that the patient does not need, and the patient overpay from oxygen, from medication, from vitamins. And so I don't know, I think we lost these bioethical elements like justice, confidentially, autonomy, and
empathy.
No maleficence as the
Oh,
worst
yes.
thing. And empathy, yes. At the time of the 3 years that I studied family doctor, we read a lot about empathy. We read a lot of studies of the economy of barrios. I don't know how to say that in English. Tus barrios, el vecindario.
Yeah, neighborhoods.
Yeah, about if you live in a bad neighborhood, you have more probabilities to death, to have more diseases, and we read a lot of resilience. So we read a lot of histories about people who suffering a lot and who just keep on their lives as the better way. So I think that after the 3 years, we just break that vision of the. I think it's a hierarchical. I don't know how to say it in English.
Hierarchy.
Yeah, as health professional, we had this hierarchic that the patient is right down, and the health personnel is up. So the personal health could make orders, could hear whatever they want, and could give the advice that they think they could give. Sorry, and as health professional, we cannot give advices. We can say the truth. We can say it with empathy. We can talk with the, the relatives of the patient, and we could make some I don't know, seguimiento al paciente. So that's the things we could do, but we don't have the right to make advices,
An
consejos.
interference. Yes,
Yes.
we can, but we cannot interfere with the patient's decision. But it's not your case. You're not in the same in the same way like the patient is feeling or something. And you cannot interfere, but of course
Yes.
you can give the prognosis as so many ways that you can follow. A, B, C, or D, maybe. You have these
Yeah.
options, and if you do this, it will happen this. If you would do this, it will happen this. And you have to explain to the patient, but we cannot interfere. That's right.
Yeah, but that's something that doctors used to do. I don't want to be a bad person and a bad doctor talking bad about my colleagues, but I think we should read more about bioethical. There in the
Yes.
history of the humanity, doctors make really, really bad things. Like remember the Second War, the Second World War, I don't know, with these
Yeah.
judge patients, judge people, with black people, like in North America. With I don't know if you heard about these syphilis cases in North America, in USA. I think it was about 80s, the 80s, that 80s or 90s, I don't know, that we find the cure from syphilis, that it was penicillin. It was so easy, but they experiment with these black people that had lots of cases of syphilis, and they experiment with another treatment, even though that the penicillin
The cure was found.
was proved that it was the cure from syphilis. So there was a lot of people that died, that get worse with the syphilis, and some child that born with syphilis, and only because they want to experiment and know what was the life of this disease. I don't remember the name. I'm gonna read about it, and I'm gonna send you to know it. And and there's a lot of examples. There's a movie, it calls Erin Brockovich, about some I don't know if you heard about it, but it was some leukemia case. Yes, and leukemia, sorry. So as doctors, we really make some bad things from patients, and I think that medicine and all these health professions should be a vocation, because if you see health as a right, not as a business, you know that you're not gonna make good money with your profession, but you can change and you can help a lot of people. You can save lives. You really can save lives. and not from the for the money, but for that vocation. And I think it's kind of difficult because I have some colleagues that they only think about money, they only think about health as a business. They administrate some medicine that are just placebo. I don't know, vitamins that the patient don't need. And it is not right, but they say, yeah, but if I don't do that, I don't have patients in the consult. And so I'm no sé, I don't know how to say that in English. Discrepo de esto. I'm not agree with that.
Yeah.
Yeah, it's kind of
I understand. Yes, because we have to be what is the word? Maybe you can tell me.
Confident.
Ethical.
Yeah.
Yes, we have to
and
be
confident with the
ethical
patient.
with our and with the colleagues. On the other hand, we have to be ethical in every single way. But sometimes, like the little story I was telling you, I was like, how come a doctor can treat so bad this woman? I was just like, tell me his name. I will go there and I will tell him something. And the woman was, no, please, no, I don't want to be treated like that anymore. That's why I will go.
A year ago, it was August 28 of 2021. I was driving from another city, from the capital of Ecuador, Quito, to my city, Cuenca. There are like 8 hours driving. So in the middle of the way, I just lost the control of my car, and I got crashed into a mountain, and I got this vertebra fractura, me olvidé. This this vertebra fracture.
Vertebral fracture.
And I was just I don't know. It was so painful, and nobody helped me until 30 minutes late of this crash, and they sent me to the closer hospital, and I told them that I am doctor, and this doctor that is not Ecuadorian, I don't want to be xenophobic, but this doctor that is from another country just told me that I don't have anything. It's just pain from the accident, and that I have to take acetaminophen. And I cannot stand the pain. And I told him that I have a condition in my vertebra, and that I cannot stand the pain. And he told me that he needs the bed when I was laying, and that I have to go home with acetaminophen. And my city, it was like 4 hours driving.
Wow.
So I had to wait until my mother drive to that city, and we went to a hotel, sleep, and the next day I came here to my city, make this scan, this CT, and the doctor discovered that I have this vertebra fracture. So yeah, it was really, really, I don't know, I just feel angry, but people told me that if I make this denuncia, if I don't know how this, I noticed this this doctor, which is from another country, could notice or demandarme, I don't know, from
we put a demand.
We could make me a demand from xenophobic. So I don't know. And I just said, well, I am a doctor. I know what to say. I know what to do. I know the procedure. But to another patient, another people, it's really
that's the
unfair.
problem. That's the problem. And I think it happens everywhere, especially here in Latin America. As you said, um, of course, we all are equals, right? But in this case, the patients believe that we are almost like heroes for them. So we have to be conscious of that. And when you have power and be conscious of that, it has two ways. One, to act like a bad person and make whatever you want and what you think, and your ego will go so up. Or be conscious of that, and with the power make the effort to do the right thing. And sometimes people choose the first one. So I think that's why they do that. Yeah. Carlita, thank you so much. It was so good talking to you. I will send to you my questionnaire again, please.
Sure, I have an answer. I don't really understand. Tomorrow we don't have classes, right?
We have class. Oh, you don't, because you chose
Today.
this day. Yes. And tomorrow you won't have to get
But
into
Wednesday we have classes.
Yes, we have the same as
Wednesday
today.
and Thursday.
The same as today.
Okay.
For you.
Yeah, I was a little confused about it.
Yes. Okay.
Okay.
Just a little picture and I'll let you go. Thank you so much.
Thank you, teacher. Have a good night. Try to sleep.
Yes, please.
Okay, bye.
Okay. Thank you, Carlita. Take care. Have a great day.
Bye-bye.
Bye or night.
See you Wednesday.
Bye-bye. Hi, Andres. I'm so sorry.
Good evening, teacher.
Good evening. Okay. Okay, Andres. What do you think about the topics we were talking about today? Do you think it's important to oh, go ahead.
Well, for me, this class was so important. I don't know about the prognosis. In Spanish, I know that, but I don't know the word, and it was very interesting for me. Yes, it's important. All topics is important for medical.
Yes. Okay. In this case, you as a student, for example, what do you think it's important to do with your patients, or to how to act with your patients? Why and why do you act like that?
Well, I think that it's important be a support for patients. You say in class that patients come to doctor for help, and it's important that doctors we have a support for patients and try to be empathy with all patients.
Yes. Okay, I agree with you, and I hope you cannot lose that interest for the topic, because I think it's really important that we can deal with this, even though years can pass by, right? But we have to maintain, to keep this consciousness, okay, or conscious, sorry, thinking about the patients and how they feel about us. They think we are like heroes, right? So we have to be, of course, we are not, we won't make miracles, but we have the power to solve some things for the patient. So it's important to be conscious of that. Okay.
Yes, totally.
Okay. And okay, can you think of an examination that you frequently carry out? And maybe you can, sorry, I think I already asked this. Yes, the last class. Okay. Can you describe a psychiatric case you have encountered in your experience?
Psychiatric. I don't have any psychiatric experience because I am in my second year of the career, but I learn about the mental disorders, the MCD book, MCD-5, I think it's called, about Manual for Mental Disorder. Personally, in my family, I have my grandfather this has a for age is very unstable. But I think it's so complicated. The work of psychiatric do is impressive.
Okay. Okay, so what would be the management in this case? For any kind of example you can give me.
For example, I know that psychiatric use tests for patients. For example, they ask they can ask the patient to the patient where do you live, what yours is, what is your name, where do you live, what month is, what day is.
Where do you live?
Where do you live? If the patient has a son, what is the name of their sons? It's a question that frequently asked for try to see the condition of the mental of the patient.
Okay. And maybe you found out that there is something not so well, maybe. What it would be the management? Would you explain to the patient or maybe to their family?
The management, I think, can be pharmacology and try to explain to family the situation because it's a disease that need much emotional support for family, for sons. It's so important that patient not feel alone. It's something that changed the lifestyle. And yeah, I think pharmacology therapy try to give recommendation to family and to the patient.
Okay. And can you choose any condition and explain to the patient?
Explain a condition, sorry.
Yes. choose any kind of condition you want, and you can explain to a patient, like we were talking about a few minutes ago. Okay, what I explained on the slides, maybe you can put on practice.
For example, I don't know, diabetes. Diabetes, for example, to explain to my patient, I say that it's a chronic disease, it's a lifestyle. The patient, I say that to my patient that it's important to try to change their nutrition, try to not 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 down in depression. It's important that the patient feels that it's a condition that they can manejar.
Manage.
They can manage, and it's important to follow my instruction and recommendations.
Okay. And when you give the instructions, you know that this is what the patient should do, right? But when you give suggestions or advices, you have to tell every single option to your patient and not interfere with the decision, the final decision. Okay?
Yes.
Okay, perfect. Okay, remember which were the points of an explanation?
An explanation. I don't remember. So what?
Okay, remember we were talking about the diagnosis and the prognosis?
Yes.
We saw it today. Okay, can you tell me of person with diabetes, for example? Can you make that diagnosis and tell me how it is it going with all these points?
For diagnosis, comment to patients that they have diabetes, any of type, if diabetes type 1 or type 2. Explain that what is diabetes, and try to explain that it's a chronic disease and it's important follow a good nutrition. Prognosis, I think that is I think I say that it depends of my patients, the diagnosis. It's if the patient follow my instruction, if they change the lifestyle that they have, or if patient not do anything.
Okay. When you give the prognosis, you should tell your patients, only your patient, or maybe the any other people of their family.
Well, the prognosis for diabetes is it's not a severe disease. It's more a chronic disease, but it's not it's not so complicated. Well, I try to explain that that it's
Okay, that's why you don't need. Okay. Okay. Okay, that's good. My question. Okay. Know if you can see it.
Yes, I can.
Oh, please. Thank you so much. I will take a picture just. And one more, and I'll let you go. Okay. Thank you so much, Andres. Have a great night. See you tomorrow. Or not tomorrow, on Wednesday.
Wednesday.
Okay.
Thank you, teacher. Goodbye.
Bye-bye. Hey, Claudia.
Hi, teacher.
How are you? Okay, is your cat with you?
Yeah, it's jumping for here, around here.
Oh, you know what? I really don't like cats. But yes, I don't like. I think I'm a little bit allergic. I don't know, but the truth is that they're funny.
Today is the International Cat Day.
Oh, I'm so sorry that your cat has to listen. I don't like cats on the International Cat Day. I feel so bad already.
It doesn't matter.
He's like, poor human.
For
Okay.
human. Yeah.
That's a good thing. Okay, Claudia, I think maybe you have some experience with psychiatric patients. So maybe can you describe a case you have encountered in your professional career?
Yeah, for sure, teacher. Um, I have one of my rotation in my internship. It
Mhm.
was in the unit of mental health at Hospital de Clínicas. I was there for 2 months. Um, well, a little bit of them are dangerous.
Wow.
Yeah, very mental people. And the other ones was like children. They don't really know what happened and what they do and why that behavior that it was uh, well they have obsessions and illusions, they really don't understand what happened in their reality. But
People.
the other kind of patients that are dangerous, well, that are complicated because also they are very, very smart people and crazy people.
Wow.
Yeah, it's interesting, but you have to take care to not be alone with them, especially in the psychotic period of the disease. That's most probably that will happen with bipolar patients and schizophrenics patients. I don't know if it's that okay, that word.
Yeah.
So it's dangerous for the personnel of health, and you have to evaluate it always. Join it with other colleagues and people who is strong, and that's because, as I told you, are dangerous also.
Okay, and you have, for example, some numbers of your colleagues to ask about a condition?
Yeah. And one of my best friends is a psychiatrist. She's the boss of the public hospital of Potosí now.
Okay.
And I most often ask to give some treatment, not specifically in schizophrenic or dementia diseases, but maybe in patients that have some periods of dementia that will be, it's an acute dementia, an acute confusion, um, that it's a condition secondary to another disease like encephalopathy, hepatic encephalopathy, for example. So in those cases, you need to sedate the patient, and you have to take care with that kind of drugs to not be a lot of sedated in that kind of patients. Also, because that patients that are very confused, it's very difficult to give them an IV or to put in an IV. So I most of the time ask her what kind of drugs I can give her for oral to relax them, to be quiet, to before to put the IV, and with the IV and the anesthetics, well, everything is more easier.
Wow. So you have to give them some pill?
Some pills, yeah.
Okay, first of all.
Yeah, because as I told you, with the confusion, they they don't really collaborate to do anything. Also, with children that it has, for example, autism or PCI, infantile, I don't know how to say, infant cerebral paralysis.
Paralysis. Yes, that's
Yes,
good.
they are very confused also, and you need to give some drugs before to take them to the operation room and give them the anesthesia for their surgeries.
Okay, such a hard procedure, especially with for the patient.
You always appear sad when I talk with you. You and
What?
worry, teacher. I will not tell you more cases that I see.
No, it's just that I can imagine how hard it is for the patient. I don't know why, but I'm really empathic. And yeah, I hate it sometimes, but I think it's the best way to know and understand the patients. I don't know, but I've been finding some limits in that cases. Of course, I cannot save everyone, but yes, I'm such a good listener for the patient, so I have to I have to just listen and wait about for what they want to say or they're gonna say. I can imagine the life of these patients. You know, it's kind of weird, but
Yeah,
yes.
but you know, uh, yeah, you have to be have empathy for the patients, but in that case is that they are really not they are need they don't realize that they are sick and they live in this world, and they think that they are real, and those things in schizophrenic patients, most of them, well, the suffering is more sad for the family. You have to act fast and be very you have to you have to be very I don't know how to say cauteloso.
Cautious.
Yeah, with the words that you choose to talk with the family, especially.
Wow. Yes, I can imagine that. I don't know where are you with your camera off. I feel so lonely here.
Sorry, teacher. Oh, teacher.
Okay.
I forget it.
Yes,
Yeah.
I forget it too. I had this, I don't know if I told you about last week. I had a patient who has this episode of epilepsy, but he didn't shake or make some movements. It was like he yelled and it was like he was fighting with someone, with somebody, and it was scared of everyone on the room, but I didn't feel fear.
Mhm.
Oh, that's a good cat. That's a nice cat.
Yeah.
Hi. And he's like, I know you don't like me. You don't like.
You don't like cats. Yeah, she's
But
very.
but 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 he or she, her color, his color, I like
Yeah,
it.
it's not a normal cat. She's a
Yes.
special cat.
Okay, I know you love him or her. Okay. Yes, that was I really didn't feel scared, but the only thing I had to do is to calm down the patient because I know in that cases they feel nervous, right?
Yeah, that's true.
Yes, and I
Uh,
was like, please calm down, take a deep breath, stay calm, and things like that. And he was trying to control himself. It was
yeah,
so
and they really feel
surprising.
ashamed, you know?
Yeah, that was the problem. I felt bad for him, of course, because of that. It was the problem was that he wasn't taking his medication
No.
because the SUS didn't cover these pills. and he didn't have the money, so it was such a big deal. I think I was suggesting to talk about with the, I don't know, social, what is it called, with someone who can help him.
A social worker.
A social worker, yeah, that's right.
Yeah, but you know, well, the reality of health in Bolivia is very sad.
Yes.
And you can see a lot of people with that cases. I think it's a minimal thing. I really see, I don't know, when I was on the intensive care unit, a mother that, I don't know, her husband was in the intensive care and she didn't can cover because she didn't have money, and she was pregnant and it was with the other baby, and it has to come to the hospital, you know, in Miraflores, and she lived in El Alto. You know, and the patient, it was the results of the surgery. I think the brain surgery doesn't going to be well. It has to be a patient that it need care for the rest of his life, because he can work again, you know. When you see that cases,
yes,
you know that, well, the health system is one of the poorest thing on this country.
Yes.
That's why most of the doctors that are taking this course wanna wanna do the steps.
Yes, to go outside country, and that's the bad thing, the worst thing, because good professionals are going outside of the country where people can pay them more. Maybe they can
They can have,
watch the effort.
yeah, and you can have the resources to treat so much patients, you know. But here is just the biggest problem, more than you can do as a doctor, you know.
Yes.
But you do what you can, at least the times that you have the opportunity, I think.
Yes, that's right. That's true. Okay, Claudia, thank you so much.
Okay,
Oh,
teacher.
and see you on Wednesday.
Wednesday.
Tomorrow you have a free day.
Okay, teacher. See
Okay,
you.
don't miss me, please, so much.
Okay.
Okay, see you Wednesday.
Bye.
Take care.
Teacher. Bye.
Bye, Kat.
Bye, Kathy.
Bye, bye. Hi, Jethro. Hi, Jethro.
Hi, teacher. Good evening.
Good evening. Okay, Jethro. Can you describe a psychiatric case that you have maybe experienced sometime?
Well, in my experience in this area, it's not expensive. It's not bigger because when I in the no in the internship we don't see these patients, right? And in my practical classes in the university, either we see these patients. When the only hospital we have here in, I think in Cochabamba, is el San Juan de Dios, is the name of the hospital, the only one I know, or maybe the more bigger. Then maybe I can choose one common, sorry, maybe maybe the more common disease in this area for me, not only in Bolivia, just in the world too, is depression. Depression. Maybe
Okay.
I can describe more.
Yes, please.
Just describe or what, teacher?
I know you're not a specialist, but since this is a common condition, you can maybe give the management, if you want, make a prognosis, and all the steps we were watching. Okay.
Okay. Um, okay. Maybe in these cases of depression is most common in the population, and I think in the more in the younger population. That's right, younger población más joven. Teacher?
I'm so sorry. Again, what was the question? I had to turn off my camera because I was losing you, okay?
Okay, teacher, I understand. Don't worry.
Okay. Can you repeat again the question? Maybe you did it?
Yeah, I say that there's most common in the young people.
Okay.
Maybe right in this population.
Okay.
And this affect all the areas like and in the social area and the I don't know how to say academic, como
Academic area.
academic, right?
Yes.
Okay, academic area and the relationships with other people like friends, family, and I think this is so. This is how could I explain this? And I think this is the more dangerous for the person. Can affect these areas, and maybe one questions for ¿cuál es la palabra? Debe ser como detectar la enfermedad.
Okay. I will make some questions to go farther into the problem, for example, or to detect.
Exactly, that's the word, detect. Right?
Or to find out.
Yeah, I think find out is the more common. Detect not much.
Okay.
Thank you, teacher.
Yes, no problem.
Find out the in this case depression.
Mhm.
Maybe patients maybe how are your energy today? Do you sleep good in the night or in the last week? Maybe.
Okay.
Maybe can you describe to me your mood and the moment? Mood is the animal, right? It's the
The
same.
mood. Yeah.
Yeah. The mood. What else? Hungry. No, that's hungry. What is your appetite like?
Appetite.
Appetite, sorry.
Mhm.
And maybe what is maybe no, right, it's not more common, but in this area, how is your relationship with your family, with your friends, or how is with your relationship with your personnel in your job, right? I think this is more common questions to the psychiatrist. If
Psychiatrist.
Psychiatrists. I think the questions in this area is like these questions. More
Okay. But maybe in your case, for example, if you saw someone that you are suspecting has a depression, I know you won't make a whole history of this, right? But on the anamnesis, maybe you can ask some questions to find out if it's the condition he is suffering of. And maybe you should make a reference or a referral to another colleague or to another area, right? To treat the patients well. But of course, you will find out that something is not right. And maybe you can help, giving some advices, not interfering with the treatment of your patient, but yes, giving some advices, especially to their families. Or what do you think?
Sorry, I can hear you the last part. Family? It's you.
Yes,
Family?
especially you can talk especially with their family, right? Or do you think it's better if you talk there directly to the patient in these cases?
Maybe, like I say, in this disease is more common in young people.
Mhm.
And maybe, yes, it's the best to talk with the family first for the help to the patient, help better than these patients, right?
Mhm.
And I
Okay.
think it helps us a lot so that we can see the all the problem in the lives of the patient.
Okay. Okay, Jethro, thank you so much. And now I have another question talking about today's topics. You saw that we have been talking about a procedure of explanations, right? The diagnosis, the management, the general advice, the prognosis, and maybe some questions, some final questions. Can you choose any disease you want and put on practice this?
Can you repeat, teacher, please?
Yes, of course. Can you choose any disease you want and put on practice those topics that we were talking about, the diagnosis, the management, the advice, prognosis, and question time, or yes?
Oh, sorry. And yes, teacher. And I don't understand very well that we, like you see in the class today, is like how these patients led the treatment or the diagnosis, right?
Yes. Why don't you ask if you didn't understand?
No, the question now.
Ah,
No.
okay.
Oh,
Okay. Remember we were talking about those steps, the protocol for an explanation, right? It was diagnosis, management, general advice, prognosis, and question time. So you can find any disease you want and put on practice this protocol.
okay, maybe I choose appendicitis too.
Can you listen to me?
Yes, teacher, yes. I say maybe appendicitis. I choose this.
Okay. Okay. Perfect. Go ahead.
Okay, management. That's how to explain to my patients, right?
Yes. First of all, you make a diagnosis, right? And you explain to your patients which one is the diagnosis.
Okay. Maybe I remember in the class, maybe I can say to my patients, in this case for appendicitis, you are suffering from inflammation for your appendix. I know I forget that appendix in English.
Appendix, I
Appendix,
think.
right?
Yes, I think. Let me check this out. But go ahead.
Okay, maybe. Okay. tell to my patient, maybe you're suffering from appendicitis. It's an inflammation for your appendix, and this is too dangerous for your life. You need surgery in this moment. We can do it. We need to do the surgery now, right? And maybe then now continue the management, right?
Yes. Okay, that's perfect.
I don't remember the steps, but I understand how to.
Yeah.
Más o menos.
Okay, maybe you already you can give some advices or you already did it and make the prognosis. And remember to ask your patient if he has any questions and if it was understood, because it's important, right?
Yes, teacher. Sorry, first one what I do now is explain the pathology or the disease. Sorry. And first one, this what is the disease, right? But maybe it helps. All right, again. Okay. Maybe that's right. No, you are or you're suffering from appendicitis and explain, right? It's an inflammation for appendix and it's for dangerous and it this disease needs a surgery. The and with surgery and this is dangerous for your life and maybe we need a laboratory test too, right? And maybe what else? Maybe yes, I say to my patient, I'm going to start you on medication to solutions and medications, right? And maybe you need referral with surgery, o sea, referencia con cirugía.
Okay.
And what else, teacher? Sorry.
Prognosis or question time?
Yeah, sorry. The question, maybe the questions, right?
Okay.
If my patients, do you have any questions like I don't know, the more common questions to my patients can ask or what, teacher?
Yes, question time means that your patient will ask you about any doubts they can have, so you can solve the doubts. Okay, and you can, of course, ask to them too in order to know if they understood what you were saying. So that's the question time at the end of the protocol of explanations.
Yes, but my doubt now is I do the questions now or
yes, I mean, you can say, okay, it was everything understood, and your patient may say, yes, it was all clear. Or maybe they can say, no, I'm sorry, I didn't understand this part. So you have to solve the doubts. Okay?
yes, sorry. Yes, teacher. Sorry,
Okay. Pedro, can you see my questionnaire?
Should I see it now?
Okay.
Now.
Okay. I don't know why it's not working. Oh, yeah. Now it is. Just one more, please, and I'll let you go. Okay, thank you so much, Jethro. See you on Wednesday, okay?
Okay, teacher. Thank you. Have a good night.
You too. Take care. Bye-bye. Hi, Carlita. Can you turn on your camera? Thank you.
Good evening, Miss.
Good evening again. Okay, Carlita. What do you think about the topics we were talking about before? Do you think it's important to have? Can you listen to me well?
Yes, Miss.
Okay. Do you think it's important to be I don't know how to say, to treat our patients on a certain way?
In the case of mental illness, I think.
Yes, yes.
Yes, well, I'm not a specialist, and I have never had the opportunity to maybe to, well, to treat these cases. So, but I think I saw once, and I think the most common illness in these cases of mental illness are anxiety or maybe depression, or also, but this is the most common. And also, I know how can I say in English, hypochondriacos.
Hypochondriacs.
Hypochondriacs, right?
Uh-huh.
Yes.
Hypochondriac people.
Thank you, Miss. I think most of people have some mental illness. This kind of mental illness, like anxiety, depression, or hypochondriacs. I, in fact, I have an aunt that it's like a hypochondriac. Sorry.
Hypochondriac.
Hypochondriac, sorry. And she lives in La Paz, but she knows that I am finishing my career. So when I talk with him, in the phone, or maybe when she came or I go to La Paz, always she have a problem. She has a problem. She have a sickness. She has a high blood pressure. Sorry,
high blood pressure. Yeah.
But at the same time, she thinks they have a lot. She listens to as illness, and she thinks she have. I think we have to be careful talking with this kind of people. In this case, it's not the worst problem in the case of mental illness, but we have to be careful because they can offend if you, how can I say, menospreciar or minimizar.
Underappreciate.
Sorry, thank you. If we underappreciate the problems, we have to attend their problems, but at the same time explain that they don't have a real problem. And in this particular case, I think the physicians or doctors sent to a psychiatrist, and she said that she doesn't want to come back to psychiatric because
psychiatrist.
Sorry.
No worries, we have to practice just that.
because they give some drugs like I think benzodiazepinas that she doesn't like to use that. And well, I'm not a specialist, but we have to have two more careful with this kind of people. Also in depression or anxiety, they have to be treated because it's common, but we don't have to how did you say? Sorry, Miss?
Underappreciated.
Underappreciated, I think.
Okay, that's good, Carlita. I understand. And talking about other topics that we saw today, maybe you can choose a condition and make the explanation to your patient.
In this case, mental illness?
If you want, you can choose any condition you want.
Well, I'm not, as I said, a specialist in these cases, but for example, I want to talk about another case I had, if I could, and it was so difficult treat with this person because I was in my rural service.
Yeah.
And I was in triage. How can I say in English triage?
Triage, I think, but let me check.
Thank you, Miss. I was there, and well, he came. He told us that he had a chip in his back, and this chip said to them. This chip had voices, sounds.
Okay, sounds.
And sounds that they wanted to attack him, and they wanted to us to remove this chip. And I thank you.
Triage.
Yes, and she wanted an X-ray. Sorry, he wanted this, how can I say, él demandaba, él a toda costa, él quería.
He demands
X-ray.
An X-ray.
Yes. So I think that that time I told with some partners.
Okay.
And we told him that we could attend him, but he didn't have SUS system, so we can attend him, but he had to pay for the attention, and if he needed maybe reference to another particular doctor, the doctor there can send with this reference. No, he insists with his problem, and the final he leave. But after 2 or 3 hours, he came back, and he said, I think he thought that we weren't. I recognized him. But yes, and he came and say that well, he came back with a, how can I say, herida?
With the bound, I think, but let me check. I forgot that.
Thank you, Miss.
Wound.
Wound. Thank you, Miss.
Yeah.
He had a wound in his hand, and he said, I need attention in emergency. I need a suture, and I saw the wound,
and it wasn't an emergency. It just have to clean and to just una curación.
Okay, he just needed that.
Yes, just that. And I explained that this case, and also I said, well, as I said before, you need to have SUS to have this free, so you can you can asegurarse. How can I say that?
You cannot insurance.
You can.
I said get insurance.
Yes, I give that option. You can get insurance in the SUS to be free. And in this case, he said that he was a patient of from the psychiatric in when I don't remember the name of the del psiquiátrico. Juan, I don't remember the name. He told us that he was on a patient from that.
No.
He didn't want to come back. So I explained again that he had to pay the attention. We could attend him, but just because he wants the attention for free, we can't. So he lives, and I think we have to be careful. I don't know how I can treat this kind of people. So I think they have to be accompanied with some familiars to talk with them.
But maybe in this case, I don't know if you can see my questionnaire.
Yes.
First of all, okay. Maybe in this case, you should talk to another personnel on your hospital or place where you're working at, and maybe try to find out if he was really a patient of the psychiatric. And since you have the numbers of these places, I don't know, maybe just give a call and try to find out if it's correct. And other thing, maybe, I don't know, it's to ask him the number of any familiar he could have, right?
Yeah.
Call immediately, just to let them know that they are here and maybe that they can help him, and try not to leave them alone, because it's so dangerous, as you said.
Yes, I think, because also he said that he didn't live in the area, so I don't know how he was alone.
Yes, he wanted attention of a specific person. I think in this case, you. Okay. But yeah, it happens. We have to be careful. Carlita, thank you so much.
Thank you, Miss.
And see you on Wednesday, okay?
Okay, Miss. Thank you.
Take care. Bye-bye.
Bye, Miss.
Bye, Carlita. Hi, Vale. Again.
Hi, how are you?
Can you turn on your camera? Thank you so much. I'm sorry I cannot turn on mine because I think it's something is happening. Here is raining, so I have a little problem with my connection.
Okay, it's fine.
Okay, I will, but if we have some trouble, I will turn it off, okay?
Okay.
Uh,
I have one
okay.
question before we start.
Vale.
So we're having today's
Yes.
the practice class, and on Thursday or on Thursday, right? Normal time or at this time also?
No, since you change schedules,
So
thank you so much for that. We have 2 days and on Wednesday. Okay, tomorrow you don't have classes, and on Thursday either. Okay.
Okay.
Okay. Can you describe, I don't know if you have any case, but can you describe a psychiatric case you have encountered in your experience?
No, I honestly, I don't have any experience since actually this year I'm taking psychiatrist for the first time. And and let's see, we already talked about we're just starting, right, with the eating disorders, maybe.
Okay, that's a good thing to start. Okay, can you talk about these problems?
So it depends the cause of the eating disorder, right? But wait, explain what, like, what is it, or
Maybe you can start explaining as if I were your patient and taking the steps we learned today or will remember today on explanations. Maybe you can make a diagnose, then you can give management and a prognosis and the final questions.
so can I change that disease for any seed? No, but it cannot be doesn't need to be related to psychiatrist, or yes?
No, it
No,
can.
any disease. So the common is hypertension.
Okay.
So you are diagnosed with hypertension. That is, this is a term for high blood pressure, and blood pressure refers to the pressure that blood applies to the inner walls of the arteries. So this is a disease, is a lifetime disease. But then not, but this disease don't actually cause symptoms. Um, you need to be monitoring your high your I don't know, your pressure. No, no es
Pressure.
your pressure. Pressure. You need to be measuring your
It happens.
pressure twice a day, or in the morning or in the night. And maybe, and you need to improve your lifetime, your habits, like eating less salt, doing at least 30 minutes of exercise, limiting your alcohol, or if you smoke, that is not good for your health and your condition. I don't know if you have any questions.
Okay, yeah, that's so good. And the prognosis, maybe?
The prognosis will be the hope the one that I already said, with your habit, that hopefully you can do exercise, or I don't know what else. O sea,
If you eat less salt, maybe, or
eat less salt, or coffee. And also be in your weight.
Okay, if you do some exercise. Okay, and maybe we can give a general advice about changing the lifestyle too, but this is before prognosis, so I think it comes hand by hand, right?
The general advice with the prognosis.
You have. Okay, and the last thing you said, it's good. Do you have any questions? And then your patient will say, yes, I didn't understand this, and you will explain to them. Okay. Okay, that's good. I want you to choose now another disease and use lay terms to explain to your patient.
What terms?
Lay terms. Remember?
No.
We saw it. Late terms is easy words for the patient to understand.
Okay.
Using not jargons. Remember what it was a jargon?
Yes, but no.
Yes, you
I don't know.
remember.
Yes, we saw it today, but I don't know. I don't remember what was. Well, another disease can be to explain.
Okay, just to be sure. Okay, while you think about another disease or condition, jargon, medical jargon, is a jerga médica. Okay, and late terms are easy words to explain to your patient. Términos sencillos, late terms. Okay?
Yes.
Diabetes.
What?
Diabetes, maybe?
Okay, so diabetes is when your no. O sea,
imagine you're talking about with your patient using late terms. So you have to.
It's okay. So diabetes is when your blood sugar is too high. I don't know if that's easy. Yes, right.
Yes, that's a late term.
When.
Okay. Okay, you explain it to me, but what happens? Or what did I do to make my blood higher on sugar?
So this is when you eat lots of sugar. No, I know. This can be when because you eat too much. I don't know if it's when you eat it too much sugar.
Okay, on your food or your
on your daily basis, or you don't. Most of it, I think, was, I don't remember if it was, what was the cause exactly.
Okay, you're explaining to your patient. But remember, if you eat a lot of things and you have bad habits on alimentation,
Bad habits.
yes, it will occur that the sugar on your blood will go high. So it is a big problem for you because it will happen that. So go ahead.
Explain it again.
Yes. Or continue till there.
I'm sorry?
Or you can continue till there.
What else can I say?
Okay, what else the patient should know?
So maybe you need to do exercise to avoid overweight and
yes, make some controls. I don't know if they need to take some pills because you already make a diagnosis. Remember, the first
yeah,
was a diagnosis.
Well, yeah. So you need, if you control your blood blood sugar levels, we're not going to give you medicine. If not, we have two ways, maybe metformina or insulina. It depends on how you how you change your habits. So I don't know what else.
Okay, okay, that's good. But remember, when you're making the prognosis, you're giving the patient the truth, right? First, what would happen if he won't react in a correct way to the advices you're giving them, and two, what will happen if he follows the instructions of the physician about their alimentation especially, or changing habits, and he will choose. Okay.
Yeah, because I think that if you do not do changes in your lifestyle, this will be this will create damage in your kidneys.
Okay. Okay, I didn't know that. And why is going to create the damage?
Because of the high levels of sugar in your body.
Okay. Okay, thank you, doctor. Thank you so much.
Okay.
Vale, that was good. Just remember those steps. I know you're getting into some diseases, and you maybe will learn these specific things later, but you already know what you should do, you have to do, and I hope it can be used when you have time to explain the patient. Okay.
Yeah, thank you.
Okay, you take care and see you on Wednesday.
On
Tomorrow,
Wednesday, yes.
free.
But yeah, but on Wednesday we're having the last class, right? Lesson.
Yes, it will be the last practical class and the last theoretical class. On Monday, well, you're gonna have the final, and that will be the last class.
And the final is what? Like a written exam or just a oral?
Written, because I'm already evaluating on the practical classes.
Okay, so written like for I don't remember what was the how was it? It was in Google Forms or something like that.
Yeah, something like that will be. Okay.
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 At what time was it? Your hour, 9 or 8?
8 o'clock Bolivian hour, the theoretical
okay.
and then the practical at the same time. I think 10:15 with you.
Okay.
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 Okay. Thank you.
Bye.
Bye, Vale. Bye. Hi, Ale.
Hi, teacher. Good evening.
Good evening again. Okay, Ale, let's talk about some psychiatric cases. I don't know if you have experience about these psychiatric cases. Do you have any experience with that?
Yes, maybe not enough, but yeah, I had experience with some cases of psychiatric patients. Especially maybe the anxious patients and the paranoid, some paranoid cases.
Paranoid, okay. Can you tell me more about that? How was it?
Okay. In the first person with anxious, they got very nervous in some cases, but is with extremely signs. They have palpitations and feel like maybe sometimes like they put a shock. They are shocked and they put nervous, have palpitations, sometimes put palo. In other cases, maybe have extreme movements, involuntary movements, not a convulsion, but like a temblor, maybe.
Okay, trembling.
Trembling.
They were trembling.
And in this kind of patients, we can have management without medication first. But when, in the second patients, they have paranoid cluster, and they have they imagine situations that don't happen or won't happen.
That didn't happen. Okay.
Yeah, but they are really, really sure that kind of things will be happen, but no. And some things are
so they have the delusion.
Yes.
Okay.
They have extremely a situation in their minds for something. And in these cases, these kind of patients need medication.
Okay. Okay, Ale, thank you so much. And now, can we talk about the topics we already saw? What happened?
Sorry, my cat.
you too have a cat?
Yes.
And today is the cat's day.
Yes, maybe.
Claudia. What happened with you guys? You that love
I don't know what happened today.
but they are
they want to
they're
stay
cute, I think. I don't like them, but they are cute. Yeah. Okay. Can you choose a condition and make the explanations? Remember the protocol, the steps of explanations? The diagnosis, the management, the advices, the prognosis, and question time.
Psychiatric patients are very hard to the diagnostic sometimes because we have
with another
other things, maybe like the dementia. This is most common in old patients. They started with confuse or sometimes forget something.
Okay.
We can ask to the patient if they remember his or her name, their country, the day. Ask to the person who is the next in the consulting, maybe a familiar. It have some episodes of confusion. We sorry.
No problem.
So sorry if they maybe lost or go to the house and they
Lucy,
maybe can.
I'm just I will take off my camera, okay? So we don't have the problem with the connection. Okay, Ale,
Okay.
go ahead, please.
Okay, teacher. The know the 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 year, the how old is the patient? It's important because they started around 60 years old, but
Okay.
it's most frequent in patients with 80 years old.
Mhm.
Oh my God. Um, okay, I forget.
Patients?
They if have episodes of confused, if they are conscious about the environment, their environment. With that, we can have a person diagnostic about dementia. I don't know what is the correct word for demencia senile.
Okay, senile dementia.
Okay, senile?
Yes.
Senile dementia. Yeah. That's basically.
Okay. Okay, that's good. And maybe you can talk about another disease. I think maybe someone easier to diagnose if you want, and give the management as if you were explaining to your patient.
Okay, a mental disease or other?
No, another one. Another one.
Okay.
Anyone you choose.
Maybe hypertension.
Okay, okay,
It's
that's
okay.
good. Yeah.
And I have to explain the management?
Yeah.
Or, okay.
Remember the steps of explanation, Ale?
Okay. Yeah, yes. The diagnosis, the management, the prognosis.
Yes.
Okay.
And the question time, remember.
Okay. For the diagnosis, I can say you develop the hypertension, or you have the hypertension. About the management, you need change your lifestyle. First, you have to take care your diet and do more exercise, more sport, and you need to take a pill once a day for control your disease, your hypertension. About your food, you can eat more vegetables and fruit. You have to eat less salty food. Yeah, you have to control your diet. About the prognosis, this part is very, 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 very important because we have to explain our patient the consequence if we don't have a correct, if they don't have a correct treatment, if they don't take the medicine or don't change the lifestyle, because the complications, the chronic complication, for example, renal or vasculation complications. We can prevent this if we explain our patients. about the illness or the disease. If when we give a diagnostic and management, like the topic of today, we can say you understand your condition, you have question, you want to that you want that I explain again, or you have you want to know something in special and is important. In I try to my patient explain to me her or his treatment. And in these cases, I'm sure that they understand, because sometimes I say, you understand? They say yes, but they forget, or they don't, they say yes, but they don't understand.
Yeah.
If they don't understand how to take a pill, how change their lifestyle is bad for their own.
Yes, that's right. And maybe in that cases, you can tell your patient to repeat what you already said. You can tell me, can you repeat what I explained to you? And the patient will be like, I didn't understand. That's the truth.
Yes. And I say, okay, no problem, I can explain again. But I have to know that they understand.
Yes. Yes, that's right. And if they have any other questions.
Yes. Sometimes they say yes, I understand, but later in the next consulting, they don't take the medicine the correct form. And when they have to take antibiotics, they have to take in hour. That's very, very, very important. But they forget, or I don't know, but don't take the antibiotic, and we don't have a good environment. No. Mejoría.
Getting better.
Or yeah, they don't get better, but I forget the word. I don't know.
Maybe you can tell me in Spanish.
No, es mejoría or mejorar, but
that's getting better.
It used
or to
other
improve.
word that I don't remember.
Improve?
Yeah. Yes, that word.
Okay, but in this case, it's
Much
better
better
use.
used?
Yes.
Better.
Get it
Okay.
Okay.
Okay, teacher.
Okay, Ale, that was good. Thank you so much, and see you on Wednesday. Remember, at the same schedules, okay?
Okay, teacher.
Okay. Have a great night, and see you on Wednesday.
Have a good night too, teacher. See you on Wednesday.
Bye-bye.